Hello everyone, my name is Nurse Sonia, a registered nurse and the founder of Best Touch Care Foundation, also the author of the Complete Women Health Guide. I'm passionate about health education and passionate about disease prevention. I have a special guest with me and let her introduce herself.
Hello guys, thank you Nasinia for having me on this
You're
platform.
welcome. The
My name is
privilege.
Jason, I'm also registered and I'm happy to be here.
Okay, Nurse Chiso, I've known her for some time now and I've been privileged to work with her. She's a sweet soul. She has so many years of experience as a nurse. We will have to draw from her wisdom today. Today, we'll be talking about what every woman experiences, but they actually don't notice it, either consciously or unconsciously. We'll be talking about heavy menstrual flow and severe period pain. Most times, people believe that these are normal things they experience, but every flow actually is telling us about what is happening in our body. Do you think having a heavy menstrual flow is a normal thing? Before you start,
Okay.
I would like to define what is menstrual cycle. Menstrual cycle is a series of changes that happen in our body that prepare us for possible pregnancy. Men just believe that okay, having a heavy flow is a normal thing with women. Some will tell you that my mother experienced it, it is a normal thing, the period pain are just normal, but they don't know that behind that normalcy they are saying, there is something the body is trying to tell them.
Okay.
You know, we have so many organs that are working together to make sure we have a good flow, like we have the brain, the uterus, the ovaries and the hormones work together to make sure that our menstrual flow is normal for the month. I would like to ask you, what is normal period?
Okay, thank you for that question, Nasinia. So I would say normal periods varies for individuals, right? Different people with a different cycle rate. So generally, according to research, it's expected that every individual's cycle should fall within 21 days to 35 expected.
Yes.
Then they should have like a 2 days to 7 days flow. But I wouldn't really specify what is normal for everybody because different people with different flows. Like if I was to go further, I would say for myself now, when I started off, I had a cycle of about 28 days or 28 days thereabout. Then I
Wow.
had another sister that I would always see her cycle 30 days. But I felt, oh, there was some we were not really we were trying to understand what was the difference, or was this normal, was this not normal? But along the line, we kept on saying that it was consistent for her. So basically, I wouldn't really say that there's a normal range for everybody. So different people have their different flow rates. But the only thing there is that you should know when your normal is going out of hand. Like having a flow rate of about 40 something days, I don't think that's normal. You should go check yourself if you're so, but that's it. So people have different normal. It varies basically. I'll just leave it.
Okay, going forward, in the case whereby, because I've seen some women that they change their pad 1 to 2 hours
Yes.
in a day, and this happened for years. Can you say that is normal?
Had 1 to 2 hours. For people that have like cycles that last for or flows that last for 5 days, and you have to change your pad every 1 hour, 2 hours for 5 days, I don't think that is normal because you're losing a whole lot of blood. I mean, if you get those feelings with, or if you get that flow, I mean, you get those feelings with dizziness, and you get to be being exhausted, you literally can't even get a hold of yourself to do anything. I don't think that's normal. Though for some people, I hear women tell me that, oh, okay, for the very first day of my menses, it's always heavy. I get to change pads first after 1 hour, 2 hours,
Sometimes second day,
second day,
actually.
right? But having to do this for someone like me now that flows for 5 days and I'm changing my pad every, I don't think it's
You'll
normal.
be
There's
annoyed.
most likely something going on down there, which I would advise that if that is you, please go see a doctor. So just to rule out that, oh, that it's just the uterus, or if there's something else there, it could be anything. It could be endometritis. It could be something else. I wouldn't want to start listing out possible complications, right? But I would just say that is not normal. If it happens all through your flow, you should go see a doctor just to be sure that we are not dealing with something under the cover.
Thank you very much. So another question I would like to ask: what of women that experience severe menstrual pain? As in the pain is so severe, some is going to disrupt their daily life. They can't do anything. Some cannot go to the office. They are just tired. They are weak. What do you
First of
advise?
all, I'll really say I'm so sorry because I've actually experienced that type of pain.
Wow.
Like it was hell all through my secondary school, right? Whereby you can't even coordinate in classes, right? Everybody knows that you're on your period because for everyone,
It's so embarrassing.
like
Yes, so embarrassing.
I would say that some certain levels of pain are okay for flow. Not everybody sees their menstrual flow without pain. Some people see all through the flow without pain, while some people first day, some people all through the day. But there's some pain that when you begin to get those type of pain, you should just know that I know this is out of it. In as much as you tend to monitor yourself, right, and you know that oh, this is the type of pain I do have. But there are times where it becomes excruciating, something severe, you can't walk, you can't even move, you literally can't do anything.
Anything,
Most times
yes.
it actually could actually be something on the line. There was a time I had such excruciating pain only to find out that oh, there was an infection. And by the time I got it treated, everything was
Wow,
my
that's
was
good.
clear. So I will say that in as much as pain is also a part of menstrual flow, right? But I don't think
Having
excruciating
that
pain or severe
severe.
pain should be like a normal thing. You should keep quiet. You could use medication to subside, but please go see a doctor. I would also advise to see a healthcare practitioner just to rule out that there is nothing going on down there. Like I said earlier, pain can be part of it, but not the unbearable ones. Not the unbearable ones at all.
So, in a nutshell, you are trying to say that no woman should manage the pain at home. Mostly when they are having this severe pain, heavy bleeding, why should they stop managing it at home?
Okay, oh well, I would say there are, like I said earlier, there are pains that are actually bearable, right? I mean, there are some women that can just use hot water massage in the stomach and they feel relieved. Some could take some medications and they feel
Sure.
relieved. Good, okay. But when your pain becomes unbearable, when it becomes excruciating, when it becomes like so wild that you can't even comprehend what's going on again, please seek medical advice. Go to the hospital, get yourself tested, get some other medications that could help. But if your pain is something that hot water could do, just gargling and taking hot water in the morning or warm water just to massage your body, to warm yourself up, then it's fine. You really don't have to like go to the hospital and or but when your pain becomes extra, excruciating, severe, that you know that this one feels like you are between the line of death and living, you go to the hospital, get to see the doctor, and you get to know what's wrong with you. If it's normal, then you get some medications, and if it's not something, if it's something that has to be treated, then we get treatment from there. I believe that. So,
Thank you very much.
you're welcome.
I really appreciate your answer and the way you explain it is so simple for people to understand. But one last question, let me say your final advice. If you are to advise women, what advice regarding this topic, what advice will you give?
I'll just say for you women out there, get to know yourself, get to know how your flow comes, get to know what your cycle reads. And if there is anything, please do not hesitate to seek medical advice. I mean, your life is more precious, very, very precious. Get to know how your body flows, how your body cycles, and get to read books. Like she made a book, you should get that book, right? It's fast selling.
Yeah.
Get a book, get to know how your body evolves, how everything happens, and you will just be informed about yourself. So anything, any changes, you could easily know that oh, this isn't normal. I have to see a doctor. I have to see a nurse. I have to talk to somebody. Don't just assume that oh, it happened to my mom. It happened to this person. And no, 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 no. Get to know you for yourself. Okay, that's all.
Thank you so much, Nurse Chiso, for honoring this invitation. I'm so glad having you here, and I believe next time we'll do more of this.
Sure.
Okay?
Yeah.
So, every woman out there, I want you to pay attention to your menstrual flow and stop being upset about your menstrual cycle. Instead, you have to pay a simple attention to your body pattern and know what to do per time. And if you are having severe I think you should talk to a qualified healthcare professional that can guide you on what to do. Don't diagnose yourself online. It's not good at all. Try and get a health professional that will give you advice on what to do. And talking about my ebook, The Complete Women Guide, is on my bio. The link is on my bio. So thank you very much for watching my video, and you'll be seeing more of our health talk on our social media handle. Thank you so much.